Welcome to the Bird Island Wellness Live YouTube and Facebook Live event. I am your host, Julie Kane, and I'm here today to talk about how to navigate menopause. That is what I'm talking about today, and thank you to everyone that's joining in and watching today's event. Um, I am a nurse practitioner here in Anchorage, Alaska. That's where I'm based. And I am also expanding my practice to Newfoundland. I'm licensed in Newfoundland as a nurse practitioner, and it is my goal to hopefully see patients there in the very near future. Our topic today is menopause. I would love, if you have any comments, any questions, please add them in the comments below, whether you're on YouTube or Facebook, or you can on Facebook direct message if you don't want to add your comment and hopefully or question, and hopefully I will get back to you. So let's talk about menopause. So what is menopause? Menopause is a natural part of aging that all women experience. Typically around the age of 45 to 55, we see this change start to happen. It is when a woman's menstrual cycle, periods permanently stop for a 12-month calendar time frame. So basically you don't have a period for 12 months. That is kind of the textbook definition of menopause. And that kind of ends a woman's reproductive years. So I'm also going to mention a few other terms like perimenopause and postmenopause. Perimenopause is another stage in a woman's life. It is the time leading up to menopause. And this is when the ovaries start to produce less estrogen. So that can happen as early as 7 to 10 years before menopause. And usually women see, irregular periods start. That's usually the first sign. And then comes some hot flashes and night sweats, things like that. Those are the early signs of perimenopause. So that's the time frame leading up to menopause. Menopause is when everything stops. And then postmenopause is when it's the stage after menopause, when, that's the last part of a woman's life. So what I kind of look at with patients and say, it's not the time of life when we should kind of shrivel up and die. No, it is what I consider, in my own view, it should be a time where we do all the things that we have worked so hard for, and this is like our retirement where we travel and we enjoy life. So that's why I'm doing this talk today, because there are a lot of women out there that suffer through these stages of life, whether it's perimenopause, menopause, or postmenopause. It is a time where, while it is natural and it is a normal part of life, it is also a time where, with all these symptoms, there are things that we can do about it. So let's talk about the signs and symptoms, so that if you're a woman out there watching, or if you are a man and you're watching and you have loved ones who may be going through, you recognize these signs. And there's, I think, over like 70 different signs and symptoms of menopause, perimenopause, and I'm just going to talk about a few because they're most common. The first one I mentioned before is changing your menstrual cycle. What does that mean? That means that you can actually, you may see that your period time frame is becoming further apart or closer together. You may also see that your periods are becoming heavier. That is a sign that a lot of women see in perimenopause. Another sign is hot flashes. And these, it doesn't mean that they have to happen every day. It could be very random, very sporadic. It could be in relation to your cycle, but this is a very common thing that women see. Another one is night sweats. Night sweats can vary. A lot of women say that they, before they went through menopause or menopause was the outcome, that they rarely had night sweats, or, so it varies between woman and woman to woman. Another sign is vaginal dryness, and this can cause, other issues, pain with intercourse, things like that. So it is something that, to be addressed and something to consider. One big one that I actually was a big factor for me, I'm 49, and this started happening about 4 to 5 years ago, was I noticed that my sleep was very affected, and I didn't know why. So a lot of women out there, this is why I'm doing this live event, is that I want to educate, and I want people to know that these are all very common things that can be addressed. So sleep is a very important thing. It's one of the pillars of health that I look at. And if you are not getting good sleep, meaning deep sleep, meaning you wake up and you feel great, then you can wake up feeling irritable, tired, all of the things. So I put a lot of emphasis on getting good sleep, and I wanted to fix my own sleep. That was a big thing for me. So sleep, difficulty sleeping, meaning, you can't fall asleep, can't shut your mind off, or you wake up multiple times a night, and you wake up just feeling very, very unrested, like you didn't get a good night's sleep. So, and that is due to, your body is losing estrogen. So that is one of the things that we see is difficulty sleeping. Mood swings. This is a very common symptom, sorry, not side effect, a common symptom of menopause is mood swings. So this is where, if we just talked more and understood menopause more, this is where I think a lot of women lack help. So you go see your medical provider and you explain to them, I'm having problems sleeping. I'm having, I don't know what's wrong with me. I'm irritable all the time. And unfortunately, the number here in the United States, it's close to 85% of women who have these complaints are prescribed medications for, like, an antidepressant. So things for mood imbalances. So I would love for patients to understand that while there is a place for these medications, I think there's more things that need to be addressed and looked at before we jump to those prescriptions. Other signs, symptoms of menopause are changes in weight. Women see a lot more belly fat. They tend to gain more weight after 40, and that's, we start to see more visceral fat, more fat here in the midsection area, thinning hair, and dry skin. So those are the more common symptoms of menopause. So with knowing those things, what can we do about those symptoms? There are many different things that women can do to help alleviate symptoms of menopause. This is the time in life where, we should have more time. We should be focusing on our diet, our exercising more, and with stress management. So those are the 3 things to start focusing on. Now, if you're starting to see, these different symptoms of perimenopause, or even if you've gone through menopause, now it's time to shift focus on, okay, what can I do to feel better? So we know the benefits of exercise. We know it can help with sleep. So when I say exercise, I mean I do recommend weight training to a lot of my patients because we need to build muscle in the later stages of life. Um, After 40, we need to build, more muscle because we're losing muscle mass. But we can also walk. Walks are very therapeutic. Cardio, exercise, anything that makes you feel better and helps decrease that stress. So, um, another big focus is diet. So, diet is one of those things where you hear um, a lot of different opinions out there. If you go to social media, it is one of those places where I wish that people just said, you know, anything can work as long as it makes you feel better. So, diet is one of those things where I think it's best to find what works for you. um, Obviously, we want to focus on good, whole foods. But, you know, when it comes to like fasting and different things, there's so many, this is good, this is bad. And I just feel like people get really confused. And I just want to put it out there that the focus should be on eating healthy foods, whole foods, majority protein, like a protein heavy diet, because with protein comes, um, more balance with your insulin in your body. And, if you're trying to build muscle, definitely the protein is key and it helps stave off all the cravings. So, you know, the cravings that you see later on, then, having more protein in your diet definitely helps. So, so diet, exercise, and stress are the natural ways to help balance all those symptoms through menopause. There's also hormone replacement therapy. So, I have a practice here um, in Anchorage, Alaska, and I do see a lot of women where I do treat them. I do hormone replacement. This is not I'm not here to advise medically. This is my medical disclaimer. This is for information only. If you feel like you want if this is something that you are considering, you definitely need to go see a medical provider, someone who specializes in hormone therapy so that they can monitor you. I do not recommend anybody doing this on their own. So let's talk about hormone replacement therapy, or HRT. Um, it's not for every woman. It is something that is a consideration. I do recommend lab work for any patients who are considering, wanting more than just the natural remedies, natural treatment. Then definitely hormone replacement therapy can be something to consider. Um, in terms of risks, you want to have a provider who understands hormone replacement therapy. And also, you want to be monitored in terms of like lab work and things like that. So, when I talk about hormone replacement therapy, it's typically estradiol, progesterone, testosterone, and I also look at DHEA for my patients. So those are the things I look at. I do labs for every single patient, and I do follow up. So that is a consideration. There are side effects with any type of treatment, so you want to monitor any side effects. I'm not going to go into that today, because I just want to kind of put it out there that there is, treatments other than the natural type. So, moving on to emotional and psychological aspects of menopause. I'm going to try not to keep rocking in my chair, but anyway, so the I don't want to say the problem with menopause. I want to say that women need to be their own best advocate. So let me go back 4 or 5 years. When we start to see these changes starting to happen, you need to be your own advocate in terms of you need to talk. about these changes. It is a natural part of life for any woman. But like I said earlier, suffering is definitely not advantageous. So I like to say, if you're having symptoms, it's good to talk about it. If you're having issues sleeping, it's good to talk about it. If you're having mood swings and you don't know what's going on, it's good to talk about it. Um, a lot of women can experience depression and anxiety, and when these things go unresolved, they make it they make it worse. So talk to your friends, talk to your loved one, talk to your primary care provider, talk to them and explain what you're feeling so that they have a really good understanding. Um, I it is my hope and my dream that, as we age, women, um, get the help they need, because there's so many that just suffer and um, don't have their needs addressed. And as a medical provider, just seeing the patients that I've seen over the years, I've had a lot of women break down and start crying because I listened and I basically um, gave them, that it was kind of like this is normal. This is a normal part of aging, and that it is, something that can be fixed. And you just listen and say, you know what? I understand because, I went through this, or I know somebody. So for me, learning all of this, it has changed my practice and changed how I myself live. So it is my goal to get the education out there so that women understand that there's more that can be done. Um, Menopause doesn't have to be a roller coaster. It doesn't have to be the end of all things. It can be where your life, everything stays the same or gets better. Um, a couple of other things I want to address is maintaining bone health and preventing osteoporosis. So as we go through menopause, there are different things that start happening in our bodies. And one of them is we start to lose bone density. So bone density is due to a lack of, we see this due to a lack of estrogen. So again, these are all things that are monitored, and hopefully your primary care, whoever you're seeing, these are things that are addressed, because that is also another piece that, you want to maintain bone health, because we all don't want to fall and break our hips and, have to have a hip replacement when we're 50. So another thing to look at. I hope that this little talk about menopause gives you some insight. It is my goal to help just one person. If I reach out and affect one life, that's my goal. I want to do these sessions, these live sessions every week. If you watch and it's, a recorded, and you have the ability to add comments, I would love to hear from you. Um, this is a very, this can be a difficult time, but it also can be something where, what, I heard her say that, there's something that can be done. So you heard my YouTube one time in life, and hopefully it provides some benefit to you. Like I said, there's lots and lots of symptoms when it comes to menopause. It's just finding somebody who can um, help you fix, if there's something going on, help you fix that symptom. So I am a firm believer that hormone replacement therapy is a great option for some people, and I look forward to hearing from you. Um, Again, if you have any comments, please add them, and I look forward to adding more content. Please subscribe to my YouTube. I am trying to reach more and more men and women. I do a lot of men's health. I see a lot of men here in Alaska, and I would say I'm about 50-50 when it comes to HRT, hormone replacement therapy. So anyway, I look forward to seeing you guys in the future, and thank you so much for watching.